The studies I found about shared decision-making is I train you, for example, to do shared decision-making, you agree to do it, and then you train another group to carry on as they usually do, and they compare the outcomes, and they haven't shown a lot of difference. They show the patients are more engaged, but in terms of actual outcomes. But you're right, that may be because we're not really doing shared decision-making, or we, in our own thoughts, have some idea of what shared decision-making might be, and we're implementing it. The other issue that you, I think, are hinting at is that many of us are probably doing this already to some extent. And depending on the nature of the problem, you think about screening for prostate cancer, you lay out some options and then say, this is something we can do, or you can defer it. How does it strike you? We probably do a lot of that stuff already. But nobody has studied that systematically that I can find. The second question about telehealth is really interesting to me. I don't think anyone's looked at how that can influence shared decision-making. You probably, like the rest of us, I think Jim is going to start telehealth today. I'm not going to be starting it until this coming Tuesday for patients, and Wednesday for primary care patients as well. So my gut feeling is, because there's going to be more verbal interaction in a telehealth encounter, or there has to be by necessity, right? I think our history taking is probably going to be lengthier and probably more thorough, because that's what we are essentially going to be relying on. It's another thing when somebody comes in and says, my ankle hurts, and you're able to actually feel it and do things. Whereas in a telehealth encounter, you really got to be a little bit more careful. So it may lead to some more collaborative discussions that take place.